Guys, welcome back to TNCT Time with Tina. Hope you're having a beautiful, blessed, fantastic day. I have a special guest with me today, Simone. Want to introduce yourself? Want to introduce yourself, Simone?
I'm Simone Carino. I am the co-founder of Faith Cancer Care Foundation.
Okay. This is my beautiful friend, y'all. Yeah, I want you guys to hear her testimony because she's positive, she's inspirational, motivational, all that stuff. So that's why I wanted to do this video with her so you guys can meet her personally and you guys are going to love her just as much as I do. So Simone, can you give us a little bit of background, like as far as your, what drove you to create the foundation, the Faith Cancer Care Foundation?
Okay. Well, I think it's only proper to first say
Okay.
what tea I'm drinking.
Oh, yes.
Okay, since this is TNC time. I'm not a tea drinker usually, but when I came in here, she had the cups on the counter. I was like, okay, I'm drinking tea today. But actually, I'm drinking cinnamon apple, and it's pretty good. I must
like
admit.
it?
Yeah,
Okay.
I do actually.
What am I drinking? I think I'm drinking, peach cobbler, organic peach cobbler. Y'all,
Yeah.
excuse me if I'm like, I feel like I'm sweating so bad because I'm like really hot. I want to make sure I make that clear in this video.
Yeah.
If I look a little sweaty, I'm having a moment, menopausal moment.
Yeah.
But anyway.
Yeah. I told her don't drink the hot tea
I
while
know,
we're doing this. So,
I know. My throat gets dry. I should have a cup of water or something. But anyway.
Okay, we digress.
Yes.
But anyways, okay, Faith Cancer Care Foundation is the nonprofit that I co-founded here in Clarksville. And, well, I am not only the co-founder of Faith Cancer Care Foundation, but I am a cancer patient, survivor, thriver. My journey with cancer started when I was only 25 years old. I was diagnosed with an aggressive type of breast cancer. And back then, they didn't have the type of staging that they have now. So I guess that gives my age away a little bit, but it's okay.
It's okay.
So I had cancer over 30 years ago. And
Okay, so before you go,
yeah.
can we talk a little bit about stages? So
Yeah.
that people understand what that means. Can you
Yeah.
explain that a little bit?
Well, okay, so stage 1, of course, is the earliest stage of cancer. And then, 2 and 3, it represents that the cancer is maybe not local. And then if you have stage 4, that definitely means that the cancer has moved to another organ or another areas of your body. So like I said back then, they really didn't have, that type of staging, but they knew right away that my cancer was really aggressive, and usually the younger you are when your cancer is detected, the more aggressive the cancer is.
Really? Oh,
So that's what I was told.
Okay.
So, I'm not a doctor, but
Yeah.
I am a patient, and that is what I was told by several doctors. So I guess back then they also didn't have as many options as they do now. But they basically told me, okay, we have to do a mastectomy. We have to remove the breast. And so what I had to have is a radical mastectomy. And so that is basically when they removed the breast and they took 38 lymph nodes. Which is a lot, I've been told.
Wow.
Usually they take maybe 3 or 8, but because I was so young, and because the cancer, when it got in there, it did look aggressive and it was large, they said, well, we better take a lot of lymph nodes to determine whether or not the cancer has spread. So that was a great concern, but thank God none of the 38 lymph nodes were affected.
Wow.
So that was almost like a little miracle, right?
Amazing, yeah.
But so I had to have chemotherapy. I had to have radiation to treat the cancer. And at that point, I got one of the drugs. I think it's referred to as the red devil, adriamycin. So I got like the shot for a lifetime. You can only have a certain amount of this drug during your lifetime,
Wow.
because it really impacts the heart, or it can affect your heart. That's why when you're a cancer patient, you'll notice that they do EKGs.
Oh yeah.
Ever so often. It's
Yeah.
because the chemo can affect your heart. And so, the chemo drugs. So anyway, so they were pretty radical in my treatment because my cancer was so radical and so aggressive. And anyway, so I went through the chemo, I went through the radiation, and at that point I decided to not have reconstruction. And I think that way back then, they weren't really so much concerned with reconstruction. They were just concerned with getting the cancer.
And when you say reconstruction, you mean implants?
Yeah,
Breast
rebuilding your breast.
Okay,
Yeah,
so everybody understands what you mean.
yeah,
Okay.
and so I decided not to do that.
Now, can I ask you something? Real quick?
Yeah.
So when you first found out you had breast cancer, that's the first cancer you had, right?
Yes.
Okay, when you found out, like, what did you feel? What was your reaction?
Oh, okay.
Yeah.
So I was actually in the shower, and I was not doing a self-exam because back then, that wasn't really something that was, yeah. But I was just taking a shower. I was just, putting on the soap or the shower gel, and I felt something on my breast, and I was like, this kind of doesn't feel right, like a little knot, a little something. And so, and when I say little, maybe inch or so, was the area that I could feel. And so I was like, I don't think this is a good thing. I mean, I think right away I know this isn't a good thing. It was hard. So it was, a lot of times when you have a cyst or something, it moves. And so that usually doesn't mean that it's cancerous. But when you have like a solid mass, something that's hard and it doesn't move, and that's something to really have checked out like right away.
And while she's saying that, guys, as women, it's good, maybe even men too.
Yeah.
Probably good to check those areas when we're in the shower, kind of just,
Definitely.
touch around and just make sure you don't feel something, because if you do,
Yeah.
like Simone did, you can get to the doctor. So yeah,
Definitely.
do your own breast checks.
Yeah, so breast self-exams on a monthly basis, that's definitely
a good
very
idea.
important, very important, yeah.
Okay, so
And don't start only when you're 40, because like I said, mine happened, when I was 25.
So yeah.
So anyway, so I had the treatments, and I did not get the reconstruction. Now, 10 years after I had my first breast removed, I decided to have my other breast removed as well. Reason being was that the doctors were recommending it because they said the older I get, the more the likelihood exists of it coming back in the other breast, And so, it was kind of hard for me to make that decision, but I had so many biopsies and testing done on the other breast that I finally decided, this will give me peace of mind, that I have absolutely done everything that I can do to limit, the chances of it coming back. And I mean, there's not 100% chance, but 99% chance,
Which is a
they
high
say.
percent.
Yeah, it is. And so I decided to have that done, and I'm so glad that I did it, but it's a tough decision. It's a tough decision for a woman to say, okay, go ahead and take the other breast too, because you kind of want to hold on to that. I know it's weird, but
no, I agree as a woman.
yeah,
Okay.
I mean, you already lost one,
Yeah.
and you would think, well, what's the big deal to have the other one gone too? But it's just hard to explain. But I wasn't happy about doing it,
Okay, another question. I'm asking questions because I know there will be some people that either are going through the same thing as Simone is with the breast cancer or the removal of the breast, or it could be coming up. Somebody could, might need this procedure done. So it's important to have somebody that can already tell you kind of what you've been through, may help somebody else. So once it was all done, how did you feel different by looking at yourself, or were you okay? Like, how did mental, because I know a lot of this is mental. At least,
I was okay with it.
Okay.
Obviously it's a big change to look at yourself, and the scar was pretty long. Like, I have a scar from under here all the way across my chest, and numbness, and it took a very long time for it to heal. So it's a
Pain
big.
is a painful surgery.
It is painful. It is painful. The healing process,
Okay.
takes a while, and yeah, I mean, you deal with that, and that's a lot to deal with. Now, when I was 25,
Yeah, and it's so young.
that was really young. But when I was 25, I think the healing process went a lot quicker than 10 years later.
Oh yeah.
So, I mean, it's amazing what 10 years will do.
Yeah.
But of
definitely.
course, I must say that it wasn't just 10 years, but it was 10 years after having had chemotherapy and radiation. Because people don't understand what it does to your body overall, how the drugs affect your body, in so many ways.
Yeah.
So it's not as if you had a healthy body and this is happening to you and you're
Right.
going through it.
Right.
So I just think my body took a big hit, and then just 10 years later having that surgery, it just took a longer time for me to heal, right?
Okay.
But still very painful. And I will say emotionally,
Yeah, that's what I was wondering about how.
Emotionally, I think I took it really well because I realized that otherwise I would be dead. And I wasn't concerned about, my husband in any way that I need to have breast, or because I have this, I'm not gonna be as desirable or whatever. That wasn't a concern of mine. But I must say that, back then it was kind of difficult to find clothing to wear, because you think that everything kind of, you feel self-conscious, and you feel that, people can tell that you don't have breasts. Of course, I chose to get the prosthesis that you insert into your bra.
Okay.
And so that's what I'm wearing now, and that's what I've been wearing for all these years.
And are those expensive?
Well, insurance will cover most of
Okay.
it, but yeah, they're
Yeah.
quite expensive.
Okay.
They're quite expensive. They last about maybe 3 to 5 years, depending, or depending how often you move them around, like in and out of bras and all that.
So is that something you just place in the bra?
Yeah,
Like,
but it's a special bra. It's a mastectomy bra.
Oh, okay.
So it's
Okay.
a bra that already has pockets.
So it fits in there. Got you.
Yeah.
Okay, because you look so natural, you wouldn't even
Yeah,
know.
thank you.
Wow.
Yeah.
Yeah.
Of course, when you're trying to wear a swimsuit or something, you have to get used to it, and you have to.
So with water, are they okay when they get wet?
They have swim prosthesis.
Okay.
Yeah, but these are like gel,
Okay.
kind of like
I
silicone
think I know what you're
gel.
talking about. Yeah. Okay.
And I think you have to overcome. You want everything to look as natural as possible. Like, you don't
Absolutely.
want people to know that you
Yeah,
don't have
yeah.
breasts and you're wearing implants.
For
But
sure.
throughout the years, I've kind of come to not care so much about that. If it shows, my bra shows, and you can tell that obviously I don't have breasts, because usually breasts come out of the bra a little bit.
Cleavage.
Yeah, cleavage. So yeah, I don't have that. And I used to try to wear like little tank tops and stuff to cover that. But now I've come to the point where I just want to be comfortable and
Yeah.
not worry about how I may make people feel uncomfortable if they see that I don't have cleavage by the scar. For
Right.
example.
Right. I got
So-
you. Okay, so breast cancer is 25?
At 25,
25.
yeah.
So what was the second cancer?
I was diagnosed with ovarian cancer in 2017.
Which was how many years later?
You
Sorry to
know,
get you thinking, but
okay, let's see, maybe 12 years later, something
okay.
like that.
Okay, so 12.
Yeah.
Okay, so
Yeah.
for me it was 10 years later for one cancer, and then 10 years for the other.
Yeah.
So sometimes they kind of space out like that.
Yeah.
Okay. So ovarian cancer, can you tell us a little
Yeah.
bit about what
Well, and I want to say this,
happened? Okay.
and I almost kind of don't want to say it, but I feel that people should know, women should know, that those of us that have had breast cancer are more susceptible to having ovarian cancer.
Wow.
And it's kind of scary, and I didn't know this, and I wish I had known, I only know that my OBGYN had told me at one time that he thinks I need to have a hysterectomy. This was after I had the second breast removed. He said to me, I think you should have a hysterectomy. But he didn't tell me like why. right?
Okay.
And I'm thinking that he knew that.
He knew ahead of time.
Right. He knew that breast cancer goes hand in hand with ovarian cancer or another reproductive organ cancer, right?
Okay.
So so I was like, no. At that point, I just didn't want to hear anything about another surgery. But then, like I said, in 2017, I had, interestingly enough, I had a hysterectomy in 2016. And it's because I had a lot of endometriosis. I have had an endometriosis issue for years, for some years. And because of that, my OBGYN had recommended me having a hysterectomy. So I had the hysterectomy, and actually during the surgery, he found a nodule. It was benign, so it was not cancerous. So I was glad to hear that. And then after the hysterectomy surgery, I had a long time, a hard time just with pains and just the recovery took a very long time.
So let me ask, so the hysterectomy removed your uterus, your ovaries, all the female stuff.
Everything.
And then your cancer came back in that area, or no?
Well, the cancer came in the area.
And then you went into remission, right? Or no?
Yeah, I went into remission.
Okay.
And for 2 years, and then my recurrent ovarian cancer happened.
How does that happen if your ovaries are gone?
Well, see, because there's still cells.
Wow.
See, a lot of people don't realize that.
This is important.
Yeah, a lot of people don't realize this, and this is why when I had the second breast removed, what they did is they pulled up all my skin and they scraped me out. They scraped all the cells out.
That makes
You
sense.
see?
That makes sense.
So this is the problem. A lot of times cancers can't be removed. You know, we think, well, why don't they just remove it all?
Out. Yeah.
But if you have a solid tumor, it can be removed. But if you have cells, or if the cancer has attached itself to a lining or something, sometimes it's just all over, right?
Which is why in my case the kidney was removed and the uterus was removed because it was inside of those areas. So they removed the whole thing. Okay.
Right.
So that makes so now I'm understanding because okay, that makes sense.
Yeah.
Okay.
So even though I had a hysterectomy in 2016, a year later, I was diagnosed with ovarian cancer, and I'm thinking, what in the world?
Possible, right?
I was thinking, what in the world? When I had the hysterectomy last year, they didn't see anything in there.
Wow.
You know, I mean, how? I mean, they did find the nodule, but it was non-cancerous. So the way I found my ovarian cancer is I had carried a heavy purse for a friend of mine, and as I was picking up the purse, I felt like a really strong pulling on my right side, and I was thinking, just something just happened inside, but I didn't know what had happened. So then I went home, and I actually walked in my bathroom, and I felt like something dropping. I was like, okay, what happened? What's going on? So then I went in the toilet part of my bathroom, and I just pulled my panties down, and it was like a big, like this big, like a clot, but it was really big and solid.
Like a blood clot?
Yeah, but it was almost like it was like I mean, it was round, it was solid, and it was just like a cyst or something. It looked, you know, and
wow.
but anyways, and there was blood with it, and so I called my friend right away, and I said, "Guess what just happened to me?" And so she's like, "Oh, you need to go to the emergency room," and I'm like, "Well,
could be serious.
Let me call my OBGYN." So I did that. I called him and I said, "This and this happened," and he said, "Well, you know, come on in." So a couple days later, I came into the office and he did an exam, and I said, "Well, what's going on?" And he's like, "Well, I think this may be a scab that's still in there from the hysterectomy, and that just kind of popped or something. I mean, I don't know word for word what he said, but I was not satisfied with the explanation.
You needed
I was
more.
like, it's been over a year, you know.
Why would a scab fall off so long?
Yeah, I mean, I'm still scabbing in there after a year. Anyway, so he said that we can do some further testing. So I had like the vaginal ultrasound and all that, and that really didn't show anything conclusive. So it was time for me to have a colonoscopy, and so I went ahead and had the colonoscopy. And after the colonoscopy, they told me that they didn't see anything in my colon, but rather they saw something trying to protrude into my colon. So something from the outside was pressing against my colon, right?
Whoa.
And so that report, of course, was sent to my OBGYN, and he then referred me to an oncologist. So my surgery was pretty quickly set up, and when I had my consult with the oncologist, he said that probably there was a 10% chance of the cancer affecting my colon, and that I may wake up with an ostomy. After the colonoscopy, we did the CAT scan and all that, and that is when they saw the cancer. But it took their colonoscopy and the results of the colonoscopy, for them
So just routine blood work won't show?
No.
Really?
No.
Wow.
No. So anyway, so then my oncologist, like I said, told me that there was a 10% chance.
So I don't want to keep interrupting.
Yeah, sure.
I just got to ask while I'm thinking.
Yeah, no.
So when they found the cancer, so pretty much with how this works, I'm guessing is that things will start to go wrong in the body, kind of like what happened to me with my kidney, and then that's how they know something's wrong as far as. So your body, they just don't know you have this stuff. I thought they could check everything through your blood.
No.
Wow. So I'm learning myself.
Yeah. And I think, and I want to say this for everybody watching.
Yeah.
We have to be just watchful what's going on in our body. Oftentimes, our body will warn us.
Yes.
Our body will let us know something is wrong,
Absolutely.
right? But we ignore it and we ignore it. But there are little symptoms, right? And so then when I felt the dropping, when I picked up that heavy purse, that was the site where the cancer was. And so anyways, when I had my surgery, my oncologist said he opened me up and it was like peanut butter everywhere. So something had burst in there.
Wow.
And so the cancer was everywhere. And whereas, they thought maybe it was like stage 1. No, after he got in there, he was like, he's never seen anything like that.
So what stage cancer are you now?
Well, because I have recurrent ovarian cancer, I'm stage 4. Yeah.
Wow. Okay.
So, but at that point, they cleaned me out, and it was the cancer had moved into my colon, and so they had to remove 15 inches of my colon.
Wow.
At that point. Yeah. And I
I never knew that.
Oh, okay.
No,
Well,
I'm learning. Just keep.
Yeah.
I'm learning. I'm learning
and
too.
so, and so I woke up with this ostomy, which was horrible.
Jeez.
So for those of you that don't know, when you have an ostomy, your stool goes through the ostomy, and so I had to have an ostomy bag or stoma. It's also referred to as a stoma. So they make a hole and they put your colon up. And so my oncologist did that. He said he wanted my colon to be out of harm's way, because if the cancer comes back, even now, if the cancer comes back, your colon is there and the cancer will attach itself. And so he was like, well, we gotta protect your colon, and that is why he moved the colon. So waking up with that was horrible. Just to know that was what I had to live with. And at that point, I was told that this wouldn't be permanent, But just having to deal with it, in the hospital and going out of the hospital, getting used to changing the ostomy bag and cleaning the area, and not ever being able to not have an ostomy bag on there because you have no control of your stool. It comes as it pleases. It comes several times a day. It comes in mushy or liquid, form. And so even, passing gas, you have no control. Like when we have to pass gas now, sometimes you can kind of, but you can't. It just comes, and like I said, you have accident. It runs out of the little attachment that you put on your body, for the stool to make it into the bag. There has to be a connection, But anyway, so that was a horrible time in my life, and I also developed a hernia. Because you have a weakness in the tissue, and so I had a hernia on that side, and I looked like I was pregnant on that left side. And only after 5 years, after my hernia had gotten so bad that I was at risk of having a bowel obstruction, because part of my colon was coming out so much and relocating itself in the hernia, that could have caused a fatal result eventually.
Wow.
That my oncologist got with a surgeon, and they weighed the pros and cons, and he said, well, I think it's time now. And they were able, thank God, to reverse the ostomy and to fix the hernia.
So they took that out. You don't have the bag.
You reversed it.
Okay.
Reversed it. So the bag's on the outside. So what they did is they reattached my colon back to what was left to connect it.
Okay.
With I don't know the proper medical terms, but it has to make a connection.
Okay.
And so I had just enough left for them to make that procedure. Yeah.
And oh my God.
That was in 2022. Okay, so that hasn't been too long. That's been only 2 years now. And I need to tell you that I'm still recovering from that. It was a very, very difficult surgery to do. And I'm still have pains because I have a lot of scar tissue. But I'm so glad, I'm so thankful that I found that surgeon that said, let's just reverse your ostomy, because I was originally just asking, can you get rid of this hernia, because I had to change my clothing and everything, because like I said, I looked like I was pregnant on one side. So I'm so relieved to have had the surgery. But yeah, in 2019, I was diagnosed with recurrent ovarian cancer. So we kind of go through the dates a little,
Wow.
But yeah, so 2 years after my chemo treatments, and I was also on a trial program, and I was on different drugs to prevent a recurrence. But unfortunately in 2019, I was diagnosed with recurrent ovarian cancer. And I kind of felt that something was going on with my body. I just couldn't pinpoint it, but I went to my oncologist and I said, I think we need to have a scan. And, lo and behold, it was there, and it had actually, spread to different parts in my body. And, at that point, I found out that it's not curable. So, of course, I went.
I was about to ask you once we got into that. Not to change the subject,
Yeah.
but you have skin cancer as well too, right?
Oh yeah, I forgot about that. So I don't know if people can see this on my nose, but yes, I had skin cancer. I think I've had it for several years, but I actually had it addressed in 2022, the same year that I had my reversal of the ostomy, and that was a horrible ordeal.
Another surgery, right?
Yeah, and actually, I didn't realize how many people are dealing with this. A lot of people do, because they have a special place in Nashville that, you know, only deals with skin cancers. And there's so many people in the waiting room that also had that basal cell skin cancer like I had on my nose. And by the way, the basal cell is like the best cancer to have. It's not, you know, it's very treatable. And so I did have a little portion on my nose, maybe like this little piece of my nail. That's what it was right there. And
They removed it, right?
yeah, they removed it, and actually they had to like dig deeper like 3 times. You go and sit out in the waiting room after they cut it out, and then they have a lab there, and they say, okay, no, come on back, we need to
Get some
increase
more.
the margin, increase the margin. And yeah, so the 3rd time they had gotten it, and it was a horrible experience, because they don't numb. I mean, they numb you, but you're awake, right?
Wow.
Yeah, and so you're sitting there and you have some glasses on, but you see like the sparks of they're cauterizing your blood vessels, because you know the nose bleeds a lot.
Yeah, yeah.
Anyways, it was just
So how many times have you had cancer? Is it the
this
3
is so I had the breast cancer, then I had the ovarian cancer twice, and then the skin cancer. So I guess 4 times.
4 times.
Yeah, so I'm a 4-time
survivor?
cancer survivor. Yes.
And I'm 2.
and we are not trying to have a context.
Oh no!
Yeah,
No!
Yeah, we're both okay with that number.
Yes,
You
yes.
know, no more.
Letting you guys know it's possible to even be, have cancer and survive. Because at least for me, when I found out I had it, I passed out. The second time they told me, I got the phone call from the doctor. I was in my room upstairs, and they said, we did the test. We found out it's cancer. Removing your kidney, and I literally fainted. I fainted, and when I woke up to the doctor saying, yelling my name, because he must have known that I was in shock, and instantly I thought, okay, I'm gonna die. You know, it's just like when you hear the word cancer, you just automatically think. So is that how you felt too initially? Like, is this it type of thing?
Well, I think the first time when I was 25, you kind of think, okay, especially back then, you know, cancer wasn't as treatable. You think, oh, I may die from this, right? And it was kind of funny, but not funny. But they had just come up with that movie that was named Dying Young. And this was about a cancer patient, you know, that was young and died. And so, yeah, you kind of think about that. And then definitely in 2019, when I found out I had recurrent ovarian cancer that come back and spread.
Okay, so let's get into that.
Yeah.
What they tell you about that?
Well, basically they told me that we can treat it, but it's not curable. And so when you sign your treatment forms to get chemo, you have to sign. And the first time around, I signed for cure, right? And then the second time, it's you check the box, and the second time it was already checked for me, just for treatment prolonging of life. Yeah, and so kind of when you read that, it's like, okay, this is kind of serious.
Yeah.
And so then I asked my oncologist, and actually I brought my pastor to my appointment. I was like, I really want to know, because it has spread. It's gone to a couple places in my body. It's no longer localized. What am I looking at? What do I need to do?
You wanted to know a time frame.
Yeah, I did. And so I said, okay, well, how long do you think I have? And I was thinking.
I want to pause there really quick. I want anybody watching the video in the comment section, what you want to know if you were told that your cancer has spread in your body. Would you want to know how much time you have? Because I think that's a question that a lot of people may wonder about. Like, would I rather know, or would I just rather it just happen? You know what I mean?
Yeah.
So that's why I'm asking that question.
Yeah,
So let
yeah.
us know, because I'm curious to know how other people feel about that.